claviotrapezius. Now, what is this? Correct. And I asked that on the question. Chromiotrapezius. What is this? Oh, yeah, now over here it's the spinotrapezius. That's this darker region of muscle, which is going to something external on the scapula, the spine. But these fibers going into the axilla are levator scapula. So levator scapula inserts on the humerus. The spinotrapezius inserts on the spine of the scapula near the root, which is the part closest to the vertebral border. Okay. So it's claviotrapezius, acromiotrapezius, spinotrapezius, the latissimus dorsi. Then here, it's rhomboids, and the more superior of the two rhomboids in this region is the minor, and the more inferior is the major. And then here, on this side, where the rhomboids, well, on this one, the rhomboids are not cut on either side. So we need another specimen. I don't want to cut them right now. We have other specimens where they are cut. So I'll use one of those to show this, the serratus ventralis, or serratus anterior. Okay, now we can't see that on this one as well as we can on the ones where the rhomboids are cut on one side. So you have to take one of those out to be able to show that. And then also, on one of those, I can show in here, where my finger is, on the inside surface of the scapula, in here, is the subscapularis. Now that's not visible on this one. So when I asked that, I wouldn't use this cat, I would use one of the others, in which it is visible. There's at least two where it's visible. Now here, we fold down the trapezius muscles. We can see that the spine of the scapula can be felt right over here. See, that's bone right there. So that's supraspinatus. This is infraspinatus. But this is not the best one for showing teres major, which is over here. There's better ones still in the bags to show teres major, which is here. It hasn't been exposed yet on that. Then over here, this is the erector spinae complex, and we need some more of this off. So we have to cut there, and then if you guys don't do it, I'm going to do it, and then so that I can point out spinalis, longissimus, and iliocostalis. To see the separation between longissimus and iliocostalis, we need to have more of this fascia off. But be careful when that comes off, though, because you don't want the muscle adhering. So you cut this as close to the vertebral column as possible, right there. Then here, this one is good for fascia lata, and you can see biceps femoris. That's here, the biceps femoris. And then that's the vastus lateralis of the quadriceps femoris. And then this is gastrocnemius over here. And then this one is good for these. Here is sartorius. Here's the sartorius. And here's the gracilis. And then, as I said, here's the vastus lateralis of the quadriceps femoris, which was internal to the fascia lata. And then the muscle that pulls on the fascia lata is the tensor fascia lata, which is over here. There are other specimens that actually show that well. This one isn't one of those, but it does show the fascia lata. Then here we have the rectus femoris, and here we have the vastus medialis of the quadriceps femoris. And then here, this is not the best one for these. So there are at least two specimens where you can see the semitendinosus separated over here from the semimembranosus, and then see the adductor femoris, which is similar to our adductor magnus. So I'm going to ask some of the hamstrings. We have to have one, if you want to see those today, you have to have one of those out. And then there's at least one which shows the soleus very well in front of the gastrocnemius. This isn't one of them. This isn't one of the ones that shows the soleus well. And then here we have the external oblique. And then there's internal oblique over here, but this isn't the best one. There are two in which the internal oblique has been separated from the transverse abdominal. So if you want to see that separation, you have to take those out. And then this is not the, now over here you have the pectoralis major. This strap over here, you can just see that you get a separation there. That's the pecto antebrachialis, which they have and we don't. I'm not asking that, but it's partially covering over the pectoralis major. Then over here we have the pectoralis minor, and here we have the xipha humerales, which I'm not asking because we don't have that.
This is the tricep.
You have to have other specimens out. There are other specimens which show this pectoralis region better. And then this is not the greatest one for triceps either. That there are at least two specimens where this dorsoepitrochlearis, the head of the triceps that they have and we don't, has been freed over here and so that it can be swung that way. Then in here you can see the separation between the long head of the triceps and the medial head. And this is long head of the triceps back over here. And then over here there's the lateral head of the triceps, but that's not exposed on this one. And then, let's see over here, and it's not exposed on this side. So if you want to see those muscles, you have to take more specimens out. Okay, because those things are